Good evening, everyone. I'd like to welcome you all to our webinar series. Today's webinar will be given by Professor Afzal Upal. A personal thank you note from me to you. Thank you so much for doing this. We really appreciate the time you have given us. Let me speak a little bit about Professor Upal's credentials. He finished a PhD in computer science from the University of Alberta in 1999. He has worked in various technical and leadership positions in computer science and software engineering industry, government, and academia over the last 2.5 decades. He is currently serving as the chair of the Computer Science and Software Engineering Department at the University of Wisconsin, Platteville. Prior to that, he served as the founding chair of the Computing and Information Science Department at Mercyhurst University, group leader of the Information, Effects and Influence groups at Defense Research and Development Canada, a visiting faculty member at Oxford University and at the US Air Force Research Lab. Professor Upal has published 2 peer-reviewed books and over 100 technical articles on various topics in artificial intelligence, machine learning, and cognitive science, all of which are very hot. On a side note, Professor Afzal and I, we go way back to maybe 21 years back. And Professor Upal, thank you again so much for doing this. We all appreciate it. The floor is yours. Take it away.
Thanks, Marcel, for that warm welcome. I still remember 23 years ago now, when I joined Dell and I met you, the brand new computer science building, the new grad student offices, which were just outside. You were literally sitting outside my office door, and the big laugh and the big voice that you had. So it was nice to get in touch with you again. Before I get started with this lecture, I wanted to say that I am an administrator now. So my full-time job is shuffling papers. I don't have time to do research or even teaching anymore. So all the things that I'm about to say, they're not really from first person. So I'll talk a little bit about the research that I used to do when I did research 5 years ago, before I became an administrator. So given that caveat, I'm going to give you an overview of the whole field of social media mining and how can you get started in this area. So that's kind of the way this talk is organized. So what is social media? Most of you know that it's interactive computer media technologies that allow people to create, share information in these virtual online networks. And depending on the regions of the world, there are different social media sites that are more popular than others. Just looking at the sheer number of users, Facebook, YouTube, WhatsApp, Twitter, and then TikTok is increasing in popularity, as you know, very quickly. And then you have region-specific social media sites like Weibo in China and WeChat. There are some healthcare-specific social media sites, such as Patients Like Me, Daily Strength, MedHealth, Health Boards. And these websites are designed to allow primarily patients, people who are interested in a health topic, to get together with other folks who are suffering through something similar, share their experiences. They provide you try to provide you more authentic information about your condition, and allow you to create these communities where people can share information. in general, social media websites allow patients to share information, but they also allow them to rate healthcare professionals and providers. So for instance, Yelp reviews allow you to do that, allow you to post these things, allow you to create ratings for various healthcare providers. Google does the same thing. And social media sites also allow healthcare professionals to connect with other healthcare professionals, and they allow healthcare professionals to provide healthcare information to users as well, to ordinary patients or potential patients who might want to connect with a healthcare provider. Similarly, the healthcare service providers can reach out to potential patients. They can provide them healthcare information. Again, the idea is that if it's coming from a well-known, well-established healthcare provider, then that information is of better quality. And then it's also marketing opportunities for healthcare providers to reach out to potential patients, make them aware of the services that they offer. So if you look at the top healthcare provider or healthcare related accounts on Twitter, you have the American Medical Association, the CDC, the Cleveland Clinic. They have, so CDC's got 4.4 million followers. The Dr. Sanjay Gupta from CNN, he's got 2.5 million followers. The American Heart Association also over 300,000 followers. So a lot of people follow these groups, and these healthcare providers provide you, again, more authentic information like this, for instance, about what's happening with the COVID variants. And academic studies of social media in healthcare are also growing. So this is a bit dated, up to 2018, but you can see the trend is pretty clear, and that people in academia are taking what's happening in social media for healthcare seriously, and they're paying growing attention to it. And so the information about different diseases, different conditions that's being provided by these healthcare professionals includes both traditional things, but also newer problems that are created because of social media, right? So you may have heard about the congressional hearings that have been going on recently, where various social media administrators, leaders are being asked tough questions about the role that social media is playing in creating various health conditions, things like depression, anxiety, and even suicide and self-harm attempts among some users. They're calling these things social network mental disorders, and they include a variety of conditions: cyber relationships, addiction, information overload, net compulsion, cyber sexual computer addiction, and so on. So this is an example of, as Bill Gates says, that these are the problems that social media created that didn't exist before the creation of social media. And what better way to address them than to talk about them on social media? That's where they were created. So the whole field of social media mining is really an application of data science to social media data. So various data science activities that are carried out in social media mining then are obtaining the data which comes from social media, then analyzing that data to extract various patterns, and then developing, carrying out statistically valid studies to figure out insights that are then useful for decision makers, that decision makers can use to make all sorts of decisions. And this is useful to everybody, right? It's not just for profit organizations, but nonprofit organizations. So a lot of work in the field of social media mining for healthcare has been done at University of Pennsylvania. And Dr. Reina Merchant is one of the leaders, and she calls the field social mediomics rather than social media mining. And this is how she defines it. She defines it as the study of collective characterizations of social media data that reflect structure, function, dynamics of individual or population. So very similar to the social media mining field. So why is social media mining growing in popularity? Because it allows organizations to better understand their current and potential customers so that they can make the right decisions. And those decisions could be about how do you get the right product to the right customer? So how does Walmart get you that shampoo, for a lower price and faster? And secondly, how can they advertise the right product at the right time and make sure that it's available in a store near you? So how do they tell you, how do they figure out who the potential customers are, and how do they advertise to those potential customers at the right time? It's also allowing social scientists as a side benefit, linguists, social scientists, to test models of human thought and behavior. So a couple of classical studies here. The study, she said yes, right? And what was the linguistic behavior of the posters before they got engaged, and what were the changes in their behavior after they got engaged? Similarly, there was this effort to look at Twitter messages by various posters in the Middle East and in Arabic. And then once ISIS came into existence, it became clear that some were pro-ISIS, some were anti-ISIS. And then these people who were collecting these tweets to begin with from those users, they were able to go back and categorize them into two groups. Either these were people who were going to become pro-ISIS or they were going to become anti-ISIS. Could you distinguish in their language use before ISIS burst on the scene? And these people had to take positions. So could you use that linguistic data and predict? So that kind of tells you what are the linguistic patterns, what are the thought patterns of the people who then eventually became ISIS supporters or became anti-ISIS. So interesting things like that. The applications of social media mining are all over the place. So you can use them to track real-time events. So there's a lot of very interesting work that happened early on in looking at social unrests in Latin America, tracking various things, tracking and monitoring the spread of all sorts of things, tracking cholera after the earthquake happened in Haiti, tracking the spread of Ebola, and tracking the spread of COVID-19 right now. A lot of work going on there. And then also to predict future events. So predicting the future stock market from the chatter about a particular stock, from doing sentiment analysis of various posts about a particular stock. And then predicting the future outbreak of flu to predict these flash mobs that were happening in London. So London Metropolitan Police did some work on, so once a flash mob happens, just by the nature of it, there is nothing you can do, right? There's just so many people that are overwhelming your resources. But if you can predict them before they happen, even if you can do it minutes before, then you can probably do something about it. Then you can direct your resources in that direction. So a variety of applications of social media mining in all aspects of life, both for profit organizations, nonprofit organizations, governments, healthcare agencies. So in particular, in healthcare, social media mining is used to carry out surveillance monitoring for public health. So again, what's going on with COVID-19? Where is it spreading right now? What are the strains that are spreading in various parts of the world? Then doing predictive diagnosis. So for things like social network issues, those issues that I talked about that are issues because of social media. What better source of information can there be than social media posts? The behavior of social media users. Could you use that to diagnose patients? And then can you look at people's linguistic patterns and diagnose various mental health conditions online without carrying out more intrusive tests where you give them, standard questionnaires and look at their responses and carry out a diagnosis that way. Can you do this sort of in a more non-invasive way, which then also allows you to do it in faster, right? In real time. There are populations that are inaccessible through traditional methods, but they are providing this information through social media, and if we can use that. And then finally, just like all other organizations, just like for-profit organizations, Walmart, Target, just like they need to study their target audience to figure out how to reach them more effectively, how to design messages which are memorable, which are effective to reach them. Similar kind of target audience analysis can be and is being done by healthcare organizations to see if they can reach patients or potential patients and design messages that are going to be more effective. So they need to learn about those audiences. That's called target audience analysis. So that's the area where I've done some of the work, and I'll talk about that briefly. All right, so all of this kind of work, monitoring patients through electronic means, not really through social media, got started with the Google flu trends. So this was a project that started in 2008 and continued all the way up to 2013-14. And what Google did is they looked at people's Google queries. And if the queries were about different symptoms of the flu or involved the word flu, then they tracked them. And when they did this study in the US, what they found was that, and then obviously they got the actual numbers from CDC, the Center for Disease Control, and they found that their Google trend predictions were 97% accurate. And furthermore, their Google search trends could predict the outcome of flu in a region 2 weeks ahead of the CDC study. So CDC gets their data from patients coming to clinicians and then being tested and diagnosed. So Google was able to do it 2 weeks ahead of that. Then in the COVID-19, similar kind of study, this is from New York Times, study looking at cell phone location data and seeing what parts of the country people are traveling more than normal or less than normal. And so again, illustrating what we can do with by looking at cell phone data from people. Of course, this is the real social media mining study. So in this particular study, The Economist did this by looking at Instagram postings. So those pictures that people post, and then looking at the location coordinates from those posts to see where users traveled after visiting a location where COVID was widespread at that point. So allows you to track and monitor for public health purposes. This is a study also done at University of Pennsylvania Medical School, and they looked at tweets discussing drug use. So they looked at the various opioids, other stimulants, and then obviously people sometimes have a legitimate prescription, for instance, legitimate need to use these drugs. And then they distinguish, so they look at whether it's whether somebody is misusing the drug or whether they're using it appropriately, whether it's abuse or whether it's non-abuse. And they found that most of the discussion is about abuse. And but there is significant discussion of use as well, and it varies depending on different conditions. Like the abuse is pretty low for metformin, right? Makes sense. That's the drug that people use for to treat diabetes, and doesn't really have many benefits in terms of being abusing it. But on the other hand, if you look at things like oxycodone, you look at things like hydrocodone, and then there is significant abuse, right? So again, monitoring social media to figure out what's going on in the real world in real time. This is another study from University of Pennsylvania. This one by Dr. Merchant's group. And what they did here is looked at Yelp reviews of various healthcare facilities in Pennsylvania. And they found that 97% of healthcare facilities in Pennsylvania did have some reviews. So it was so Yelp and Google reviews are quite comprehensive of healthcare facilities in Pennsylvania. And they found, and when they did topic modeling, so the words that occur more frequently in the negative reviews, they are shown bigger here in this particular picture. So you can see that told was the word most frequently used, right? So patients don't like to be told. So again, this is useful information for healthcare providers so that they can avoid negative reviews. And for this study, they again from Dr. Merchant's group, they combined both Google and Yelp reviews, and these reviews are only for substance abuse treatment facilities. And as you can see that not all reviews were negative. So your first impression might have been that only people who get ticked off are motivated enough to go out and actually take the time to type in a review. But that was not the case. As you can see, 43% actually rated these facilities at 5. So that's good to know that people who think of them as positively also go out and write reviews. So this is this study tells you that that the ratings actually make a real world difference. That those ratings are not just random and arbitrary. That the facilities that have the highest ratings, when you compare them to the facilities with the lowest ratings, you find that the rehospitalization rates actually differ. So remember, these were studies of treatment facilities, right, for drug abuse. And so there is a significant difference. People are not just willy-nilly randomly making up these numbers and posting them. There genuinely are differences between those facilities. So that's good to know. All right, so these are easy to collect numbers. You just collect the frequency, for instance, of the words that appear and other things like that. Interesting things happen when you apply machine learning algorithms, and then you can do a lot more interesting, cool stuff. So you can actually diagnose patients, and if you can do reliable diagnosis, then you can do real monitoring. And you can also do this target audience analysis that I said that I was involved in doing a study. Okay, so let's talk about how is machine learning then applied to social media data. And I'm going to again talk to you about the study that we did, where we looked at 6 Twitter groups, and this was done in 2015, this work. So we collected tweets from these 6 Twitter groups, and these were the US Republican Party, Water.org charity, the Toronto Maple Leafs hockey club, the Procter & Gamble's product Always sanitary pads, Medicine Sans Frontières, so Doctors Without Borders, PETA, so People for Ethical Treatment of Animals. So these are large groups. They have, lots of followers. In case of US Republican Party, you can see, over 1.25 million back in 2015. And they were posting lots of messages. So we had access to lots of them. So we downloaded around 12,000 these messages. Then the first question that you have to ask when you look at this kind of data, when you want to apply machine learning, is how do you select features? So what are the important features relevant to predicting? So if we are looking at target audience analysis, then the question that you're typically interested in that kind of scenario is what is it that makes some messages more popular than others? So why do some messages go viral and get thousands and millions of likes and retweets, and other messages that get none, that nobody pays any attention to? What's the difference between them? How can we design messages that appeal to a given target audience? So there have been a few social media studies. So Lenore Schiffman, she's looked at social media messages, and she identified things like positivity, messages that are positive are more likely to become viral. Emotionality, messages that arouse emotions are more likely to become popular. Messages that ask audience for participation. Remember that ice bucket challenge, right? So they ask the target audience to do something. They become more popular. Messages that are perceived as coming from prestigious resources, and messages that allow an audience to position themselves on the right side of the issue. So an impression management aspect. There is this study by a group from business professionals, Lee et al. They looked at Facebook messages, and they found that the messages that a message that you could imagine that one of your friends would post, they're more likely to become viral. Messages that are humorous, again, that emotionality idea. Messages that mentioned an event on a holiday or mentioned the remarkable fact. Messages that had pictures, videos, or had a URL where you could go and click and find more information. Messages that had been posted for a long duration, messages that had just lived, that had been around for a while, they were more likely to be to become viral. Then, so these are just the social media studies. In general, if you ask cognitive scientists, if you were to ask psychologists, what are the messages that are likely to become popular, they point at things like memorability. So these are not electronic media studies. These are not social media studies. These are real world studies. So in the real world, a message you can't spread a message to somebody unless you remember it, right? You have to remember and recall it. So therefore, various factors that impact memory. If a message is coherent, then it's more likely to be remembered by people and therefore more likely to become widespread. Again, the emotionality idea. If a message is arouses emotions, if a message is concrete rather than just high abstract. So if it's like an apple rather than democracy or freedom, right? Those are more abstract concepts, then it's more likely to be remembered by people. If a message is surprising, then it's more likely to be remembered. If a message is humorous, then it's more likely to be remembered. So things like that. So we looked at both of those studies and we selected this list of 22 features. So how long a message has been posted, whether it has a picture, whether it has a video, has a URL, whether it asks you to like it, whether it asks you to retweet it, whether it asks you to carry out a real world action, asks you to go visit their website, asks you to donate money, asks you to participate in an event, whether a message is repetitive, if a similar message with a similar content had been posted before, whether a message is about an event, whether it's personal communication between, let's say, Toronto Maple Leafs and a fan, and it's about, a shirt that they bought from their store or something. It's personal communication. It's not really public. Whether a message is positive or negative, whether it's surprising, whether it's arouses emotions, whether it's humorous, whether it's concrete or abstract, whether it's coherent or incoherent, whether it is about social identity, whether it invokes us versus them kind of a thinking. If the message is false, exaggerated, right? If it's ideological, religious, if it invokes some well-known conspiracy theory, if it is conspiratorial, whether the message is a coherent story, so it's a sequence of events, this happened and then that happened, whether a message is arcing narrative, it's an event, it's a story of the type, our group, our nation used to be great in the past, and then things went wrong, and now we can restore the old glory. It's kind of like Make America Great Again, that kind of an arcing narrative message. So, so these were the features that we selected, and then we asked I asked some research assistants to look through these 12,000 tweets that we had downloaded and manually look through them and code these messages for whether they had these 22 features in them or not. And then we sorted these tweets by popularity, and we measured popularity by just simply computing the sum of the number of likes a tweet had and the number of retweets that a tweet had. Then we computed a couple of different data sets. In one data set, so the binary data set, where we classified tweets into popular and unpopular. Popular were the tweets that had the top 10% likes and retweets, right? Remember, we computed just added likes and retweets. And then the bottom 10%, we call them unpopular, right? So this was just a binary classification problem, classifying tweets into either popular or unpopular, those two categories. And we ignored the tweets in the middle. For the 10 popularity class, we clustered the tweets into 10 classes. We looked at their popularity numbers, which were likes and retweets, and then classified them into 10 classes. So the idea then here would be that you would try to predict the range of how popular was a tweet. Did it get between 100 to 1,000 likes and retweets, or did it get between 0 to 100, that kind of thing. So more finer grained categorization of the popularity of tweets. So this is what the top and bottom 10% look like. So these are the Doctors Without Borders, Medicine Sans Frontier tweets. And so these are the top ones, the ones that had most likes and retweets. These are the bottom ones, had no likes and retweets. And these are the ones in the middle, which we completely ignored. So we picked up these are the popular ones and these are the unpopular ones. That's how we turned into a binary classification problem. Then these are from the US Republican Party. And again, these are the popular and the unpopular ones, the very few likes and retweets and lots of likes and retweets. And then this is the result of that clustering algorithm. So for the always pads tweets, the ones that had between 0 and 95 popularity measures, like and retweets, they were put into group 1. And the ones that had between 12,000 and 15,000 got put into group 10, right? So these were those 10 groupings that we did for. So these are for Toronto Maple Leafs, these are for water.org. So the boundaries were drawn differently depending on the group. Okay, so again, for the first study, we hired these poor research assistants who had to do this mind-numbing repetitive task of going through these 12,000 tweets, and for each one of these features, they had to say whether this feature was present in that tweet or not. So whether a tweet was emotional, surprising, whether it was repetitive, whether it had a URL and video in it or not, Then, of course, for URL and videos, we could actually do some automated analysis to help out these research assistants. But these poor suckers worked for months and months going through these 12,000 tweets. And, so once they had, so this is what I asked them. I asked them, please mark a 1 if this feature is present, and mark, a 0 if the feature is not present in that tweet. All right, so once we got that data, so now we had features, we had categories, now we could run machine learning algorithms. And we ran a whole bunch of them, and random forest seemed to do the best in this particular task. The results are pretty good. So, right. So in case of PETA, we are looking at pretty much, 100%, 99.5 in terms of accuracy. So really good accuracy numbers. So it is possible to figure out whether a tweet will become popular or unpopular just by looking at the content of the tweet. So that's really good to know. And these are the kind of rules that Random Forest discovered in these tweets. So for the US Republican Party, if the tweet has a picture and is emotional, then it's more likely to be popular than unpopular. If a tweet does not have a URL and is negative content, right, and has been around for a while, then it's is it likely to become popular or not popular? I think likely to become popular in this case. So you can see, rules like that we could discover that that somebody who is designing these messages can actually use, and these are helpful to them. Similarly, the results for the 10 classification problem, which was a difficult problem, so it didn't do as well on, for instance, the Toronto Maple Leaf tweets, but on others, the results are comparable to the binary classification. So again, really good results in terms of that it is possible to distinguish between popular and unpopular tweets, and it is possible to derive those insights that can be used by message designers to design more effective messages. So we did some analysis. So these were the kind of factors that were common to all groups, and then some things that were unique. So, and again, they make sense in hindsight, but again, it's good to automatically discover that insight. So for instance, for water.org, a charity that raises money for, installing wells in Africa, for instance, negative tweets, so stories that were mostly negative were, were more likely to become popular, whereas in Toronto Maple Leafs, the stories were more positive, were likely to become popular. And then we found things like social identity, us versus others, was a good predictor in the US Republican Party tweets, but not so in other groups that we looked at. So interesting insight, right? That you can discover through analysis like this. So the problem with this study was that the effort that it takes to manually code these things is just, it costs so much, it takes so much time. So that really is a bottleneck. And the question that we asked in the second study was, is it possible to eliminate that effort? Can you automatically create features for a machine learning algorithm? And there's a lot of work in that area on applying machine learning to Twitter. And the features that people have found most useful are these word n-grams. So a unigram is a 1-word, bigram is 2-word phrases, words that occur consecutively. 3 grams are the 3-word phrases, words that occur consecutively. So, and then you look at the most frequent n-grams. So the words that occur, the phrases that occur together. And then also character grams. So just letters in a word, letters that occur consecutively. So people look at 3 grams, 4 grams, 5 grams in terms of character grams. So and then again, pick out the most frequent ones. And then you can use them to predict the binary, popular, unpopular, or the 10 class, more finer grained predictions about how popular a tweet will be. All right, so the features then look at something like this. So these are unigrams, the word Hillary Clinton, 1 word, and this is a bigram, 2 words. Lock her up is a trigram, right? So 3 words occurring frequently. And then this is what the features look like. So each one of those tweets, then we've got, either the feature is present or it's not present, right? So that's what the feature space looks like. And then we can use that to then apply machine learning to do this. So and even with this particular classification task, random forest turned out to be the best again, and really good results. So comparable to the human manual coding. So you don't really need people to go through that effort to code those things, and both for the 10 class and the binary classification problem. So these are really encouraging results. The downside is that we no longer have access to those rules, right? Those insights. So we can do the prediction, but those insights are harder, and those insights are sometimes more useful than just the raw results themselves. So of course, that's what we used it for target audience analysis, but this machine learning setup can be used for pretty much anything. And in a lot of studies that I'm going to talk about next, it was used for diagnosing various conditions. So whether somebody has been diagnosed with a particular condition or not in the real world, and then seeing if we can do that automatically. So a disease could be a target class, whether somebody suffers from depression or not, whether somebody abuses alcohol or not. And then you could also look at various events. Events of a pregnancy, for instance. What do people's messages look like before pregnancy, after pregnancy? Can you predict whether a message somebody is posting is before something happened to them or after something happened to them? So this is a study from Dr. Merchant's group where they looked at Facebook posts from people who either suffered from depression or not, and then looking at the linguistic patterns and seeing whether it is possible to predict whether somebody who wrote this tweet is suffering from depression or not. And again, they found really good results that it is possible to actually make those predictions. And then that also helps you learn what are the kind of predictors of depression by doing this real world analysis, right? In this particular study, Dr. Merchant's group looked at predicting a whole variety of diseases, such like hypertension, diabetes, depression, anemia, and all sorts of things. And then again, they were able to make those predictions with 75% or higher accuracy. So really good results. In this study, they tried to predict whether a message, a social media message, was posted by somebody who is either in prior to the pregnancy, prior to the delivery or after the delivery. Is it a day one after the delivery, or is it after past the 3-day period after the childbirth? So again, they were able to make those predictions, and they were able to figure out, what are the pre-pregnancy linguistic patterns, what are the during pregnancy linguistic patterns, what are the post-pregnancy linguistic patterns that people use in their social media posts. Predicting whether somebody would visit a hospital or not. Can you distinguish between people who didn't visit a hospital and people who did visit a hospital? And then what are the linguistic patterns of people before visiting a hospital and then after visiting a hospital? Can you make those predictions? And again, the same sort of a machine learning setup. And these were the predictions about the opioid overuse that I talked about before that study. So these were the kinds of things that people are posting. So the idea here is that these are really hard to access linguistic patterns. If you wanted the traditional kind of a clinical diagnosis where you need a more intrusive interaction, those are hard to get. And through social media data, it is pretty easy to get these patterns. So one of the things that they found in the drug overuse patterns is that there are different times of the year where drug overuse is higher than others. So for instance, in January, February, it is a lot higher than other times. And it is true for whether we're talking about Adderall or oxycodone or various diseases, various drugs. This is the Dr. Merchant's group has put out this Twitter map, and I have a link at the bottom of it. You can go to it and get the live map, which is updated every 20 minutes or so. And you can look at all sorts of interesting things. So if you can do diagnosis through Twitter, then you can use that diagnosis. And if that diagnosis is reliable, then you can use it to monitor and track all sorts of conditions. And you can do that in real time. And that is what a map like this allows you to do. So this is a dashboard which allows you to ask all sorts of questions, restricted to various US regions, various states, look at what are the topics that people are discussing right now on Twitter. And in this particular case, how COVID is being talked about. And through that kind of analysis, they found that they could actually predict what are the symptoms of COVID a lot before CDC published their results about what are the predictors for various strains of COVID, for instance. All right, so I'm going over my time, so I'll try to finish quickly. So the basic lessons, take-home lessons from here are that social media mining allows you access to real-time data, which would be inaccessible otherwise, that it can actually be used to do this, to diagnose patients fairly reliably. This kind of work can help by identifying features that are more predictive, because you're doing this study in the wild, right, with real world patients. And if the diagnosis is reliable, then we can actually figure out the features which are more predictive, which traditionally clinical studies had not shown. And that this kind of work can also improve monitoring for public health, and it can result in these really nice dashboards, these really wonderful, very helpful and effective tools for public health. So I know there's a lot of doom and gloom about the use of social media, how it's leading to misinformation and all sorts of stuff, but there is this positive as well, that it can also be used for public good. So the same thing that's leading to all sorts of misinformation and bad things can actually also be helpful. So I think that's the sort of the lesson that I want you to draw from this.